Hi, everyone. Welcome. My name is Kristen, and I'm on the marketing team here at GoPivot. Thanks for joining us for our second webinar of the series. Today, we're going to talk about boosting immunity with Dr. Michelle Thompson. Hi, Michelle.
Hey, Kristen.
Yay. And we're joined by Julie, our Director of Program Management. Hi, Julie. So if you joined us last time, welcome back. If this is your first one, we really hope you enjoy the content today and get some good takeaways from this. Just a couple quick housekeeping notes. Reminder that all attendees are muted during the webinar, but you can type questions for us on the right. So if you have any throughout, we'll do our best to answer them. At the end of the program, we will have an official Q&A for any remaining questions that you might have. Second, this webinar will be recorded and emailed out to everyone here today. We will also have the recording available on our resources page at GoPivot, as well as on social. So you've got several ways to access it if you need it and want to come back to reference this material. So with that, I'll go ahead and pass the mic to Julie to get us started.
Hey, Kristen, thank you so much. Appreciate the introduction. I'm just going to switch slides here real quick. So I could not be more thrilled to be here today and introducing one of my very best friends in the whole entire world, Dr. Michelle Thompson. I'm super excited to have her here with us today. I'm going to introduce Michelle. She is a triple board certified physician of integrative, lifestyle, and osteopathic family medicine. Her specialty is reversing disease through diet, exercise, and lifestyle changes while empowering her patients to take charge of their health. In addition to her private practice, Dr. Thompson has studied and taught massage therapy, neuromuscular therapy, and integrative healing. She is an advocate of understanding how to use food as medicine and has been active in teaching the whole food, plant-based diet to people in her community. Hey, Michelle.
Hey, Julie. I'm so happy to be here. Thank you for inviting me.
Yeah, I am so excited to have you here. This is some really good information that we're going to be talking about today. I love the idea of using sleep, love, food, exercise as medicine. I get it. I love the idea that not everything is a pill, not everything is a prescription. So I know today you're going to share a lot of ideas with us today about how really to holistically take care of ourselves and boost our immune system, which I think is really important to a lot of people today to understand how to keep themselves healthy when we have all of this craziness going on in our world, right?
Yeah, yes, absolutely.
Yeah, absolutely. So I want to jump right in because I know that we are limited on time. So our first slide here is food as medicine, and you have listed here improving our microbiome through food. I am really excited that you wanted to talk about microbiome today because I don't think that enough people know about even what it is or how we need to keep it healthy. So give us some information about improving our microbiome, what our microbiome is, and what we need to know about it.
Yeah, so, it's really come down to, in my world, that the microbiome is really just your key to health and longevity. And so, the microbiome is the bacteria that lives within us, and we want it to be rich and we want it to be flourishing. And I really do kind of compare it to a compost pile. So, when you are throwing food in the compost pile, you are going to choose to throw in, carrot tops and peppers and onions, and you're going to throw in all these colorful things in your compost pile, and that's going to break down and that's going to create this amazing rich soil. But what's ended up happening is in the standard American diet, we've started throwing things in our compost pile like Fruity Pebbles and McDonald's hamburger and a piece of fried chicken, and that does nothing for your compost pile. So if you think about the body needs this bacteria, a lot of times what's happening is the bacterial balance is just off. And when it's off, it creates a lot of problems with disease processes and all systemic disease processes. So not just the stomach, but the skin, the digestion, the bowels, the bladder. There's so many different, the brain, one of the things that I'm a big advocate for food as medicine, mind, mood, and food. There's such a huge association with our microbiome in our brain. brain. So just by the addition of adding berries, the reds, the blues, and putting those into our diet is so important. So, really just diversifying our nutrients is important. And so I don't want people to ever get overwhelmed with thinking about their microbiome, although my husband walks around the house going, this is for my microbiome, because he hears about the microbiome all the time. So just thinking about, I heard your, webinar that you did, and it was great. It was like, wow, like she has so much information to share. But, putting in things that have that normal bacteria and have that color and that, eating the rainbow, that's going to help to keep us safe. So that's where our phytonutrients break down and all of that stuff. So, if you think about the processed foods, there's no bacteria on them. They're made in a lab. There's, as opposed to going to your little market where you got your fruits and veggies, and there's going to be some natural bacteria on there. So, I think that that's important to consider at this time, because that's one of the things that's really going to keep us healthy. Absolutely.
I love when I find a bug on my vegetables.
Right? Yeah.
That tells me that it hasn't been out of the ground for all that long. It still has bugs on it. So that's a good thing, right? Sort of.
It's a great thing. I mean, the first time that happened to me, I was like, ooh, that's gross. And I was like, no, that's amazing, right? So, one of the, I take care of a lot of people who really care about their health and wellness. In general, my practice is lifestyle integrative medicine. So people come to me to reverse disease. So I had this farmer once who was telling me about how some of the farmers are taught to put chemicals on the cows to keep the flies away. But what that does is it actually keeps, it's dangerous, and then it's not good for us to ingest. So the flies don't want to go on the cows. The people shouldn't then be eating the cows. So, you want to put the cows in shade to protect them from the flies, as opposed to fill them with a bunch of chemicals. And it's the same. It's the same with our pesticides and our herbicides that, kill all the stuff on the fruits and veggies. So, yeah, so I think that, one of the biggest things that I can impress upon in people is thinking about the nutrients that you're putting in your food and in your mouth, and, thinking about the colors, thinking about especially boosting your immune system if you're thinking about that, doing vitamin A rich foods, vitamin C, quercetin, zinc rich foods. And I have food lists developed for all of those that I'm happy to share with you, and we can get out to everybody to know about. And really then just thinking also too about your prebiotics and as well as your probiotics. So, just increasing the fiber in your diet. Fiber. I mean, I've heard you say this a million times, Julie. People don't get enough fiber. And if they do get enough fiber, they may not be getting enough water. So we need to get enough fiber, we need to get enough water, and then we need to get enough of the probiotic type of things. So, just trying to think about that. We're not big bread eaters in my house, but we're doing a little bit of sourdough now because that has some great probiotic in it. We're doing some miso, we're doing some kombucha, we're doing, sauerkraut on our potatoes, and, just adding those types of things in. So, yeah, I mean, I think it's just thinking about variety.
Yeah, let me ask you, how would someone know that their microbiome wasn't healthy? Are there symptoms that someone might feel when their microbiome's not healthy, that might be, one of the first things you think of if they say, I feel blank, you think, oh gosh, it's the microbiome?
Well, everything comes back to the microbiome. If my dietitian was on here with you, I mean, and if I didn't say that to you, she would be like, no, everything's related to that microbiome. Anything that you're experiencing, I think that what we need to remember is that every food that we put in our mouth matters. So, if you're experiencing muscle aches and pains, joint aches and pains, if you're experiencing fatigue, if you're experiencing brain fog, if you're experiencing, chest pain, shortness of breath, those types of things, you're likely not putting those types of foods into your body. So, when we think about our athletes, this is a perfect example. Our athletes really want to focus on high nitric oxide foods. Why? Because those foods are rich in oxygen, and they're going to go through the bloodstream, and they're going to make them run fast, hard, the best ever, right? And so that brings us back to our food is really the safest and most powerful form of medicine, or the slowest form of poison. And like you said in the beginning, one of the things I say all the time is that no disease that can be treated with diet, exercise, and lifestyle should be treated with a med, you know, and truly we've learned over time, Nexium, you know, the proton pump inhibitors, the H2 blockers that we take for GERD or acid reflux or digestion, heartburn, those wipe out our microbiome, right? Mm-hmm. And so what are those pills? Those pills really are just a Band-Aid for the standard American diet. So then we go back to, if we improve our microbiome, we don't need those medications. And then we start to dabble in that food as medicine type of thing. So, you know, if a person has heartburn, they say, I can't go without my H2 blocker. I mean, they just pulled Zantac off the market because of, you know, it has now a black box warning of cancer and stuff like that. So everybody's kind of freaking out. What do they do? And sometimes you truly do need your proton pump inhibitor if you have, you know, certain disease processes or GI bleeds. But really, you know, trying to do things like papaya enzyme, ginger root, you know, strategic food placement that actually can help to settle down the symptom that you're experiencing, what you were talking about, and then be able to not need that at all, because then you know that the microbiome is rebalanced and it's not causing that. Bloating is a huge one that I see all the time. People say, I eat and I look like I'm 9 months pregnant. And what that really is those bacteria that are in your belly are not balanced and they're not happy and they're giving off a gas and they're just kind of like, they take in something and it's not settling well with them. So it gives off this gas and it causes that bloating sensation. So once you rebalance that microbiome and you rebuild your, i.e. compost pile, you know, then your digestion improves, everything else improves. So you're not having as much issue with, you know, all these other things that people are experiencing. Skin, you know, skin is actually, I hear this all the time. You know, my husband, you know, I hear him say, you know, the skin is the largest organ of the body. And really it is. And you see tons of skin issues come out because of the microbiome and the imbalance. So like psoriasis, eczema, rosacea, things like that. So really just improving. It never hurts to work on your microbiome. So we should be doing that breakfast, lunch, dinner, snacks, and thinking about, you know, the colors, the reds, the blues, the oranges, the yellows, you know, how can I make it more colorful? How can I make it more diverse? How can I improve my phytonutrients? Because that's what protects us and works on longevity, you know, because our goal is to prevent disease, right? It's not to just stop what's happening. It's to live beautifully and age gracefully without medication. Yeah. I mean, let's face it, you know, it's expensive to be sick, right? We don't want that to happen. And nobody wants to go to the doctor's office. I get it.
Unless they're coming to see you.
They still get all nervous.
So I love that. So it really feels like as we move on to sleep as medicine, that kind of our core starting place is the food that we put in our mouths. And then we kind of move on from there and see how we're sleeping and how we're dealing with stress and kind of, you know, all of these other things. But our food and what we're putting in our mouth is like the starting point, right? It's what's creating our overall health. So talk to me a little bit about sleep as medicine. So you're saying that we can improve our immune systems through sleep, which I totally believe, because I'm very affected by the way that I sleep. If I have a bad night's sleep, it stinks, you know. I mean, I'm affected. My stress levels are different. My mood is different. I don't feel like exercising. You know, I feel a little run down. It's no fun.
Yeah, it's not. And honestly, these things matter, right? So we have to eat, you know.
Yeah.
We have to do it. So, you know, we should make good choices and we should try to repair that. If we have bad habits now, we should try to repair that while we have this time during this, you know, during this difficult time that we're all going through. And we have to sleep, right? And we should be sleeping 6 to 8 hours a night. And yeah, exactly. If you are not sleeping well, you're not going to be sharp. You're not going to be as quick on the jaw when you're making decisions. You're also going to be more edgy. You're going to, you know, if somebody says something to you, may otherwise be like, no problem. You don't sleep well. You're going to be like, you know. And then you're not going to make good, you know, I used to say food matters, food is the most important thing, but I honestly changed my mind when, you know, I was going through a lot of the lifestyle medicine curriculum, and we were starting to look at sleep in general. If you don't sleep well, you're not going to make good choices. You're just going to say, I don't care, I'm going to eat that cookie. Whereas if you slept well, you're going to say, no, I care. I feel, you know, like I slept well, I'm going to make a good decision. Or, like you said, I don't feel like exercising because I'm exhausted because I didn't sleep well. And so what that ends up doing is it actually ends up causing this problem that decreases your immune system. You know, it's not as strong because it's not as healthy and it's not as robust, because when we sleep, we're healing. And so we're never getting that complete healing, which, again, when it comes back down to what do I think is the most important, is making sure you don't have sleep apnea. You know, those people that are snoring, they're not even getting enough oxygen when they sleep. So I have people tell me, I'm sleeping fine. And I say, well, okay, you have sleep apnea on your test. And they say, well, but I feel okay. And I say, well, then who needs that oxygen anyway? Really? I mean, come on. I mean, but we have to start to think about that, because over time, I think one of the things that we have learned is that, or again, looking at longevity, we're looking at prevention. If you're not sleeping well, if you're deoxygenating in the night, or you're not getting a restful sleep, you're going to have issues with testosterone. Guys, you know, I mean, that's a big thing for guys to think about, because they want to make sure they're keeping their testosterone level good. Heart function, you know, your heart's a muscle. So, you know, lung function, those types of things. So if you're not doing well with your sleep, then you are going to have oxygen deprivation to some of the most important organs in your body. And so we really need to, you know, remember that sleep is the root of everything that we're going through. So, you know, if you pick one thing to focus on, let's say, okay, this week I'm going to focus on sleep, you know. And I always tell people, don't get overwhelmed. Don't leave me and say, okay, I got to eat better, I got to sleep better, I got to exercise, I got to be working on my stress, I got to do this. No, just pick one. And if I said today, which one do you want to pick? Pick sleep. And so how do we fix our sleep? You know, some of the stress management type of things. So deep breathing, you know, slowing down, quieting your mind, not having your cell phone near you, you know, warming the room, putting in an essential oil diffuser, keeping the TV away. You know, some people use melatonin, and I think that that's beneficial, especially now. I mean, there's proven benefits of melatonin as a supplement for boosting the immune system during a pandemic as well, but it also helps with sleep. And then things like yoga nidra. So yoga nidra really is sleepy time yoga. So it really takes you into that dreamlike state. And yoga nidra, you can Google it. You know, there's yoga nidra all over, but it walks you through your body, and it really helps you to kind of come back in to your body, not thinking about all the things that you didn't get done in the day, not worrying about everything you have to do tomorrow, but just coming into that present moment. And I think the other thing too is, you know, if you wake up in the night, you know, go back to your breath. You know, count. You know, remember when we were kids and they would say count sheep. You know, what were you doing? You were counting your breath, which is super boring. So you lay there and you start thinking about, okay, you don't want to count your breath, count sheep. I don't care what you count, but you're going to lay there, and if you're not supposed to be thinking about the past, because, you know, then you're like, oh, I didn't get this done. Not worrying about what you got to do tomorrow. You just go back to your breath. You eventually fall back to sleep. Sometimes even using things like tea, you know, herbal tea is something I love. You know, I love like the yogi bedtime tea. Traditional medicinal makes a great organic nighty-night tea. And then just putting it in this much water, you know, not like the full cup. Because if you do the full cup, then you're peeing all night. Yeah. But, you know, just, you know, doing a little bit, a shot's worth of it to just kind of take you down.
Yeah. I like that a lot. I hadn't thought of ever making a cup of tea, not as a full cup, but what a great idea just to make a little shot of it. Yeah, even maybe chill it with an ice cube or something, so you literally can just take it down and let the effects of it do its job.
Yeah, and absolutely. And I want to throw that out there too, because some people will tell me, like, I don't want to drink hot tea. It's summer. And I say, well, you don't have to. You know, steep your ginger tea. Ginger's great for digestion. I have a cup of ginger tea every day of my life. And it's good not just for digestion, but for hormonal balance, you know, estrogen, testosterone, progesterone balance. So ginger is like one of the best things in the world, you know. So I do that, and I put it over ice, or, which is another great idea, throw it in your smoothie. So, you know, if you're having a smoothie for dinner and you just want, you know, some kind of calming tea, or a honey lavender, or a kava tea, or a chamomile, or something like that, a good quality tea, use the liquid in your smoothie. You know, mix it in with something else. The thing we're doing right now is pomegranate. So we have pomegranate juice, and we'll do sparkling water, pomegranate juice, and a splash of herbal tea. And it's just, this much thrown in there because I don't know, it's like exciting.
That sounds really good and pretty. Do you drink it in a champagne glass?
I absolutely do. That is so funny.
Do it.
Yes, because if you don't want to be drinking alcohol every day, because you don't want to end up in somebody was telling me that as throughout this pandemic that people were just gonna end up as drunks. I don't think that's a very good idea. But you could throw that in a nice fancy glass, and you can add fruit into it. So you can add a berry or blackberry, blueberry, strawberry, something like that. And honestly, I've been squeezing lots of lemons and lots of limes into everything, on my salads, into my soups, into my waters, into my teas. I don't normally do that. I'm normally, just a kind of a plain water girl. But, how could I increase my vitamin C naturally? And, people will say to me all the time, should I take a supplement? No, eat it. If we can eat it, eat it. Sometimes we need supplements. Yeah, vitamin D. I live in Ohio, so my practice is in Pennsylvania. There's not a lot of sunshine here right now, so I am taking vitamin D from a personal standpoint. But those of you who are in Florida and somewhere sunny, you may not need to take vitamin D at this time.
Looking out my window, it's a vitamin supplement day.
It's a vitamin D kind of day. And I just want to go back to that, actually getting outside. And that's one thing I didn't mention when we're talking about the microbiome. Think about, this is funny, when we were in Palu at the yoga retreat, there was a guy walking down the road and there were all these bugs around him. And I saw him from across the road and I was like, oh my God, think about what that's doing to his microbiome. It's really, in our air, there's, bacteria. We're not really thinking about that. Right. So, don't be afraid of all the bugs that are out there. You have to be afraid of some of the bugs, but.
Right. Got it. For sure. Yeah. Awesome. So, I know that we could talk about sleep forever because it is, like you said, number one on the list of things that we really need to focus on so that everything else fits together, like exercise, right? Because if you're not sleeping well, you're probably not exercising well. And I know for me, even though I can usually force myself to do some sort of workout, even when I haven't had a good night's sleep, it certainly isn't, I'm not going to the fullest extent. It's kind of a half my effort goes into it. I'm like, well, better than nothing kind of thing. But I know cardiovascular exercise definitely helps to prevent disease. You're here saying also that it improves the microbiome. We're fighting disease. Tell me just a little bit about, how exercise in the body actually works. What's the physiology behind that?
I kind of mentioned that your heart is a muscle, and I think sometimes people don't think about that. When you go to the gym, you go, oh, I'm gonna work out, my bicep muscle, I'm gonna make my bicep muscle big. People forget that your heart is a muscle, and we want to keep that strong. So from a cardiovascular standpoint, 30 minutes a day, 5 days a week, 150 minutes a week, we should be doing some sort of something. So, even if you're doing a 12-minute or 15-minute high-intensity interval where you're going along just kind of, a little bit, and then you increase for 40 seconds or 20 seconds or whatever you choose as your pattern for high-intensity interval, it's definitely going to challenge your heart. And that's what we want. We want to keep that muscle strong. We want to keep it guessing because that's the other piece of it, right? If we just do the same thing every day, it's going to get used to that. But if we vary it, so I have all kinds of, hit on the elliptical, on the treadmill, on the bike, even just, in the house exercises that you can do. So, maybe you do mountain climbers, maybe you do jumping jacks, maybe you do, usually when I have medical students or residents with me, I'll say, you can do a wall squat and you're going to, be working on your muscles as you're doing that. So I make my residents do a wall squat. They learn over time. They're going to have to do some jumping jacks. They're going to have to do some exercise while we're there because we do it with the patient. Because, think about what do you do all day now, right? You sit. Especially now we're in front of computers. So, I think that we have to remember that, if you don't use it, you lose it. And, one of the things that we've seen over time is people that go through cardiovascular problems actually can improve their cardiovascular fitness from cardiac rehab. It's proven. So, just because you've had problems before doesn't mean you have to have problems for life. So, and I think we gravitate towards what we like. So if you like yoga, you want to just do yoga. If you like running, you just want to run, right? But that's not what we need to do, right? We need to make ourselves do things we don't like.
Right. Yeah,
because they're good for us. The variety is good for us. So, there's days that I force myself to go and, actually one of the big things I force myself to do is yin yoga. Yin is more of a sleepy time yoga, like a relaxing, it's more just stretching, but it's good for this. And again, we don't say, oh, I'm going to work out this. But one of the things that we know is our brain, if we take good care of that, we can prevent dementia. So it's really important that we find that time to quiet our mind. And, again, you don't go to the gym and go, I'm going to work out my brain, right? And everybody thinks about their biceps and their glutes and their hamstrings and all that stuff, but they're not thinking about their internal organs. And we do have to focus on those things.
So let me ask you a question. So when it comes to working out your brain, to me, I guess, and I think this is what you're saying, correct me if I'm wrong, but it's more work or harder to quiet your mind than it is to just let it flail out of control and think, thoughts constantly nonstop, where, so the action of thinking is actually easier than the action of not thinking and clearing your mind. So that's really the exercise of the mind, right?
Yeah, and people don't like it because it's hard. And I agree, it's really hard. But I like, I force myself to do these things, and I've gotten better at them over time. I'm a busy person too, and I get it. I keep going. But during this pandemic, I'll be honest with you, I had to increase my, meditation, mindfulness, my yoga, my Tai Chi, the Qigong, those kinds of things, because, in a pandemic, naturally, we're in a sympathetic state. We are in that fight or flight. We're in fear. We're in trauma. We're being chased by a tiger. We can't even see it, right? So it's scary to us. And so I'm actually a chair of medicine for University of Pittsburgh Medical Center. So I'm in meetings all day. So I have 2 to 4 meetings in the day, and then I'm seeing patients who are having fear and all of that around their experience with, this. So I was strategically placing it in lots of parts of my day to take it down. So I'm not in that sympathetic all the time. But is it easy to go from sympathetic, go, being chased by a tiger, to parasympathetic, rest and relax? No. But we have to, because we remember that even if I am eating the most perfect diet and all, going back to the food, I'm not going to digest it because I'm in sympathetic state. I'm in a stress state. I'm in a go, fight or flight state. But I have to go to that parasympathetic state so that my body knows it's time to eat. It's time to digest this beautiful food that you're putting in to rebuild your microbiome. So it all really does complement. And, as an osteopathic physician, as a holistic physician, you can't just look at one system and expect that you're going to fix it. You have to really, all these things kind of come together. And I do think people will find what they like and what works for them. If you don't like meditation just sitting there, do a walking meditation, do a Tai Chi, do a Qigong. Because some people that really resonates better with them because they want to be moving. But those people that tell me that I'm a runner, I'm only going to run, not going to cut it, because those people still end up with cardio problems. They still end up with, issues with dementia because they are not diversified enough. Here we come back to the diversification of the things that we put into our body, the ways we treat our body, being in that one state versus another. Too much of a good thing is not great, right? So it has to be that balance, and that's what it all really comes back down to.
Yeah, and I'm wondering too, I had a day this week that was probably not my best day, and I was really, I think I was very much feeling that sympathetic space where I was way up here, and I wasn't really even realizing it until I heard my husband say, "Are you okay?" And I said, "Why?" He said, "Because I keep hearing you take deep breaths." And I was like, I hadn't even really noticed that I was taking those deep breaths. And then on my lunch hour, I did a streamed yoga class, and it actually made me feel a little emotional. And it was because I quieted everything and realized that I was like kind of letting myself flail out of control. And it felt so good to like rein it in and bring it home, and bring it internal. And I just, kind of wanted to speak to all of the people out there that might be feeling that, that anxiety, and maybe not even really realize what's going on, or not even realize that, kind of where they are until they, find some time to quiet themselves and calm themselves.
And I think it's, thanks for saying that, Joel, because I think it's important for everybody to know that we are not perfect. Just because we're in health and wellness, like we still work on this as well. And we are all in a pandemic together. We are just trying to figure out how to survive. But really, that's life in general. We're all just trying to figure out how to survive. But I think the important thing also to think about is that awareness, that, even if you create a little bit of awareness, like you were able to, first of all, great job going to your mat. Even if you didn't want to be there, great job getting there. And that's what I always say, like just showing up is like sometimes the hardest part. But, whatever you take away from it, even if it's just that ability to lower your heart rate a little bit, we know that we can lower blood pressure 20 points by meditation, yoga, any of these modalities, but we have to show up to it. So, it's equally as hard. So that brings me to something I should say is scheduling. I mean, prior to this webinar, I turned off 15 alarms on my phone because I have everything scheduled, because if I don't schedule it, it won't happen, because we'll be busy and we'll be sitting and we won't get up and do the things we need to do. So I think set yourself a schedule, hold yourself accountable, have some awareness. And what do you want to do? So I say to myself, okay, well, I want to do this for my cardiovascular fitness. I want to do this for my mental fitness. I want to do this for my food. And you kind of put it all in there. One of the things that I found from working from home is that I wasn't eating. I mean, I eat great normally. I have everything planned. I'm a prepper. I've got my breakfast. I mean, I walk into my office with my bag with everything for the day. But I've been home seeing patients for 6 weeks now. And I would just get to seeing patients, and I wasn't getting up, and I wasn't eating my orange, my apple, my grapefruit, I missed lunch at 3 o'clock, and I'm still seeing patients because I'm just trying to get through the day. That's not a good idea, so that's where all the alarms came in and the scheduling. So I think that, and again, every week I look at my schedule on Sunday and go, okay, what can I do different this week? Because quite honestly, this is, unprecedented times, right? None of us have ever had to deal with this, and we never will again, thankfully. But how can we get through it in the healthiest way possible? And how can we use it really as a global reset for our health and wellness, so that we can use this time in a very positive way and develop some more healthy habits, really, I think.
I couldn't agree more. I mean, why not use this as a positive time, right? It's a great time.
And it's hard on all of us. Even though, there's so much that's hard. Or even if you're just going along and you're thinking to yourself, somebody's not eating today, somebody's dying, it's sad. It's a sad thing. So it hits you, and it's okay to hit you, because I think that it's important for us to have those emotions and allow them to happen. We need to create space for that in our world, to actually feel. Once I was in a yoga class and they said you have to feel in order to heal. And I think that that's really powerful. The whole time is hard for all of us, but we're all in it together. And I think as long as we stick together, and I give virtual hugs to people all day long. I believe that we're all in this, holding hands virtually around the world. We're going to try to take what works and keep it, and get rid of what hasn't worked with all of this. And it's definitely changing.
Yeah, are we talking about love is medicine? We haven't even brought it up, but it seems like this is evolving right into love is medicine.
Yeah. I mean, because I think that it is important to have a grateful heart, and always, but especially in a time like this, because, as long as we have our breath, we're alive, and we should have something to be grateful for. And I think flipping the switch, instead of fear all day long, or, complaining all day long, or watching news, binge watching news and all the negative stuff that's out there, and, people mad because this has happened and that's happened. It's happened. Whatever's happened has happened. But what can we be grateful for? Because love is powerful, and, our heart is powerful, and compassion is amazing. And I think that when we start to really delve into that, and we look at people as humans, that's one of the things that I think that this really brought out is humanism. We're not all just going anymore. We've had to stop. We've had to think. We've had to feel. We didn't take time to stop and think and feel before. We just had places to go. We had things to do. And I still have places to go and things to do, but I'm really trying to tap into, one of the things that I say is, social distancing doesn't mean social isolation. And so I'm a very social person. I've had to very much figure out how to make myself present for my patients, for my community, for my friends, for my family, and for me. I have to take fun times and have a fun happy hour, and I've been doing social Zooms with my community just to hold space. Again, back to holding space for people, letting them know they're not alone. You don't want there's actually, social isolation is a poor determinant of health. So it actually, if you're socially isolated, you have poor health outcomes. So it's really important that you find your tribe and love them hard, right? Whatever tribe that is. And I think the thing that this taught us is it doesn't have to be in person. You and I know that because for 20 years, we've not lived in the same place. Right. 24 maybe. It's been a long time since we've not lived in the same place. So we've done virtual coffee and, right? How many years have we actually done that? And that always feels good. Right? So that lowers your cortisol level, raises your happiness factor, it's the positive psychology of all of that. So, and I think we need to tap into those things. So, one of the big things that I actually was teaching my patients, people, I'm very successful getting them on the video platform, but I push hard to get them on the video platform. We can get them not just on our My UPMC platform, but Zoom, Google Duo, Skype, FaceTime, Facebook Messenger, you name it. I try hard. And the reason I try hard is because I want to see them. I want to see their face. I want them to see my face. And I then want them to reach out and see somebody else that they love and care about face. I want to teach them. Yeah. Part of being a physician in lifestyle and integrative medicine is education, and knowledge is power. So when I teach these 88-year-olds how to get on a platform, it's good for them, because then they'll be able to socialize, and they'll be able to meet up with somebody else, and they'll be able to get a smile on their face. So, yeah. So,
and don't you think you can read somebody's face too? You kind of will know if they're feeling, really isolated or down or sad or depressed or anxious. You can kind of see that in their face. And so I think that's why this video chat is so nice to have, because you can look them in the eye and know how they're doing.
Right. Right. I've learned to do a lot of things actually on these video platforms that I never would have imagined that I would have been able to do. I really took my practice and went from a traditional in-office practice, seeing all my patients in my office, to telemedicine overnight. I flipped a switch and I went into this world of looking for people in cyberspace, is what I feel like I'm doing most of the time. But when I get them there, I'm so happy that they're there, and they're so happy that I'm there. And I think that that's one of the other things we have to remember, is to stay connected, and collaborate with people, and think about, you have to think outside of the box. None of this is really what we signed up for, but how can we make it happen? Like that exercise, everybody's gym is closed. So what can we do differently? Not everybody has a bike or not everybody has a treadmill, or you know, you and I are doing a program next week called Exercise as Medicine during a Pandemic. You know, grab 2 cans of corn and do some bicep curls and do some, you know, shoulder presses and do some deltoids. If that's not heavy enough, grab some spaghetti sauce, you know, grab a couple bags of flour, like do some, you know, right? I mean, we've had these discussions. So nothing, you know, we have to work through the barriers.
Absolutely, absolutely. So tell me a little bit about, I think this is our final slide. You mentioned just some lifestyle choices, and I think we've kind of touched on a few of these already, but just some, I guess, additional things that are going to help to boost our immune systems before we wrap up today.
You know, I think, you know, we're all in life on a journey, and I think, ask yourself, where am I on this journey? And check in with yourself and be honest with yourself. You know, you can't fool yourself. And think about where you've been and own it. Can't go back, you know, and every day is a new day, clean slate. My son will tell you all the time. My son's 28. Julie actually babysat my son when he was little. That he'll say, I always say to myself, new day, clean slate, can't hold on to that, you know, don't let it get the best of you. But that was one of the best things I ever taught him. And, you know, your best is good enough. So your best is going to change from day to day. You know, I think you and I have talked about the book, The 4 Agreements, before. I love that book because, you know, nothing anybody does really is a result of you personally. It's because whatever they have going on. So during this time, you know, we're going to be frustrated and, you know, edgy with others that we may not have otherwise been, because this is a hard time for each and every one of us. And I think, you know, knowing that your best is good enough. So if you have a cold, if you have a headache, your best is going to be different from day to day. Our best in a pandemic is not going to be the same as our best in, you know, the real world. So asking yourself, did I do my best today? And saying, if I didn't, that's okay, let it go. Yeah. And I'm going to give it my best shot tomorrow. And I think the positive self-talk is so important. You know, don't hold on to the negative. You know, I was just talking to somebody about, you know, how does this not bother you? Well, I say, well, I let it go. You know, it's no longer serving me any purpose. You know, by me holding on to something that went wrong or it wasn't as planned, it's really not going to serve me any purpose. I just have to let it go. It wasn't, you know, in line with what was about to happen. So I think just loving yourself, you know, knowing that you are your own best healer. And if you haven't done it this way for 80 years, you can start now. You know, there's this time, there's all of this information out there in the universe now, right? We're in cyberspace, we're all connecting. Yeah. Reach out to somebody. You know, you're not alone. You're not alone. Reach out to me. You know, I get random emails, and I do talk to everybody. I have somebody that screens all my emails on bewelltherapies.org, but generally I reply to every single person because they've reached out for some reason or another, and they need a connection. So I think that's powerful. So.
And I think on the flip side too, and if anybody has any questions, feel free to write in now because we're going to get ready to wrap up. But I just wanted to say that you mentioned, like, you know, if you're 80 years old, it's not too late to start. I also feel like for the younger generation, even our kids, you know, we've, like Michelle mentioned, we've been raising our kids together for many, many years, but they, and maybe it's just them because they've had us as examples all their lives, but I hear them using terms like self-love terms, like they're processing their thoughts. They're having healthier relationships. They are exercising regularly. They understand, you know, meditation and yoga and these other ways to take care of themselves. And if you as a young person out there can learn this stuff now and implement it, wow! I just got chills.
Right.
About
me too. Me too.
Game you are, right? Like it is never too late, but let me tell you, all you youngsters out there, if you're not doing it yet, you can learn something that will make your life all that much better. So it's pretty cool. But I see Kristen pop back on. Hey, Kristen.
Hi, can you guys hear me?
You need to answer?
Yeah.
Yes, actually, and I love this question because this is a personal struggle of mine. Dr. Michelle, do you have any advice for getting your husband to get on board with eating healthy? I love it. I love it.
Oh, great.
Years of work.
Okay. So, first of all, I wanted to say that leading by example is so important. And just because, so my history is I've been a vegetarian for 27 years. So I've changed my diet on multiple different levels. But, you know, just because you eat one way doesn't mean that somebody else has to eat the same way in your house. You know, we raised the son a different way that I ate and, you know, my husband ate. So I think it's important to know that you should eat for yourself, first and foremost, and that you should not food shame others and judge others, but you should lead by example. And so Julie just said, you know, who knows if our kids are the way they are because we were an example, but I really do try to be that example. And I don't point a finger. I mean, my husband will tell you, like, I don't. It's his choice. But then if he complains about something, then I say, well, I mean, think about what you ate. My son is the same way, you know. I think just really giving the person a platform to be curious, to be slow and gradual. There's a great book called Deceptively Delicious. And that book, you can hide food in things. And I think that's great because you can hide spinach, you can hide, you know, things that you wouldn't otherwise. Increasing their nutrient profile by just doing little things. Julie, I brought my masala daba tray because I actually wanted to just kind of throw this in here. This little thing, if you guys can see this is a tray. I have to be careful with this because actually I was trying to show a patient my soup and I dumped it on the floor. But this little tray, I know, as like only me. This has 7 different things in it. And in there, I have 2 of these. And in there I have like almonds, pepitas, coconut, sesame seeds, ginger. Julie taught me to put the ginger in there. I don't know why I didn't do that. Brazil nuts, flax, chia, you know, different things that you can add in. So starting to just go slow, start slow and just get them to maybe just do a smoothie a day. You know, you can get a ton of things. I'm not a smoothie person just because I eat too much, like I like to chew my food. But just, I have tons of smoothie recipes I'm happy to share, but just getting a smoothie in, you can get tons of, you know, I have food as medicine lists for like calcium, potassium, magnesium, like I said, and you just put all that stuff in there. Iron, people think they need to eat meat to get iron. Really, you absorb better from plant-based sources. So, you know, you can get a ton of stuff in your smoothie. So I think just being patient with them, not pointing the finger, not bullying them, not making them feel bad, but letting them know that food is powerful, you know, and really they have the opportunity to make the change. I can't tell you how many patients I still get in their 80s to make changes. And never give up on them because it's not too late. I always ask people, what made you make the switch? Like, what now? Like, I've been telling you this for 15 years. Like, what now? Why now? And you just don't give up on them. You know, I had a student once tell me, you know, this patient's not going to make a change. And I said, that is the minute you no longer need to be their doctor, because the minute you give up on them is the minute you're not going to ever help them. So I think that's the other point is with your spouse, with your loved ones, don't give up on them because, you know, just be gentle with them. And, you know, when you go back to the 4 agreements, saying things with love and kindness, that's better than pointing a finger and being a bully, right?
Yeah. So, yeah. That's awesome. That is such good advice. And I'm going to use that myself. So thank you for that.
And patience, lots and lots of patience. Lots of patience.
Yeah. Well, that kind of segued nicely into another question that was asked. What's some of your favorite feedback to get from your own patients?
I mean, that they'll say I changed their life, but I say no, you changed your life. Like, I don't make the changes. I am their biggest cheerleader. I am their guide. I help them. I educate them. I empower them. But when they say, oh my gosh, I didn't even know I felt this bad until I felt this good. A lot of times people just come to establish with me just to have a doctor, and they hear that I do preventative, integrative, and lifestyle medicine. And now I'm completely online, so I mean, I have no idea where this is going now with being able to, I'm meeting people on screens all the time. But knowing that they came feeling okay, and then we tweak some things from a nutritional standpoint, exercise, sleep standpoint, and then they feel even better. And I tell people, you know, the goal is to, again, age like fine wine. Like, you know, just because you're 80 doesn't mean you have to feel bad. And women that are going through menopause, they'll say, well, I'm in menopause now. Like, I'm over 50. I'm not having sex anymore because I'm over 50 and I'm through menopause and I don't feel well. No, you should feel amazing. And if you don't feel amazing, you know, reach out to your doctor because they'll help you to feel amazing.
That's great. That's phenomenal. Well, Julie, do you want to go into our upcoming webinars? And thank you so much, Dr.
Absolutely.
Michelle. This was
you're
incredible.
So welcome. Thank you for having me, guys.
Yeah, absolutely. I knew it was going to be fun, and it was everything that I expected and more. So thank you so much for coming and being with us today. And I miss you. I love you. Some really great upcoming webinars as well. So Dr. Lenore Doster is going to be talking about mental health and how it matters. She is our CEO's wife, and she is fantastic. You won't want to miss that. She's really fabulous. And then our own VP of Customer Success, Ross Patterson, will be talking about burnout on the 21st. He has a business on the side, a nonprofit that he helps executives and such with burnout. When it comes to, you know, their work, their daily life, what have you. He is also English, so you'll, you know, even if you just want to listen to him talk, because he's a great actor.
Highly recommend.
He's really fabulous. So please join us again. Thank you so much for coming today. Again, thank you, Dr. Michelle, and we will see everybody very soon.
Have a great day. Be well, everyone.
Bye.
Thank you so much.